empty follicle syndrome, it is a very common problem, but it is very less talked about in the medical fraternity, because if there is empty follicle syndrome, it creates a lot of distress to the patient as well as to the doctor, because the doctor doesn't know what to go and tell outside. So empty follicle syndrome means your follicles are being seen, the estradiol level is normal, but when we aspirate those follicles, there is no oocyte, there are nil oocyte. So there are many causes of it. First and foremost, it can happen in patients who have got very low AMH score, because if the egg reserve is low, we make the eggs, but those eggs are empty. Secondly, it can happen when you have not taken trigger at the time, because the trigger injection is the last injection which is for egg maturity, and if you don't take that trigger injection on time, or whether you have not maintained the cold chain of those injections, so it is also a cause of empty follicle syndrome. Thirdly, obviously, if the technique is not used properly, the aspiration is not proper way, then also the empty follicle syndrome comes. But usually, if you are showing at a good center with a good experienced doctor, usually the cause of empty follicle syndrome lies with the patient herself, means the body is like that, the egg is not being formed, the patient also cannot help it because her body is like that. Then we need to do different things, because in these cases many times we have changed the way of triggers that are being given or the way of stimulation that is being done, and in some patients we have recovered follicles in the next cycle. After the first cycle, the patient has landed in empty follicle syndrome. We have had patients who, with those second cycle embryos, they have already delivered babies. So if you are having empty follicle syndrome, then also please don't lose hope and keep on trying, because that is the mantra for success. We care about you.